Order. Today is Thursday, June 4th, 2020, Board of Health meeting. Just to remind everybody, this meeting is being audio and visually recorded. Remote participation via Zoom and YouTube are also available to the public. Pursuant to Governor Baker's March 12, 2020 order regarding open meeting law, provisions have been approved to conduct these meetings remotely. If you are a registered attendee, please use your full name for the record and direct your questions to the chair. There is a comment section, which if you get a question in, Roberto will try to do his best to monitor that while we're conducting this meeting. For attendance purposes, could you just say whether you're here or not? And I'll start with the board members first. James Cooper.
Here.
Colleen Weld.
Here.
Malcolm McNabb.
Here.
We also have a few other people attending. Leslie Snell from PLUS.
Here.
John Giorgio from Town Council.
I'm here.
Yeah, we got you.
Yep.
I think the rest of the board members will be on. Rita's not quite on yet.
Yeah, Rita's still not on and she hasn't mentioned anything to me yet.
Okay, well, we'll just, I'll turn it over to you for
I have to unmute first. So with this being our first Board of Health meeting since some of the civil unrest that we're seeing around the country right now, and in light of the amazing protests and the beautiful peaceful protests and the speeches that were given here, we just wanted to quickly address it as a Board of Health and as a health agent. I'm gonna stick to the script this time so it's not as emotional as it was yesterday. So I'll just go ahead and say, that the murder of George Floyd and the ensuing outrage has shed light on a brutal reality that affects far too many people in our country. Our own United States is deeply divided when it comes to race. The wounds are deep and the trauma transcends generations, and the anguish is real. Racism is a systemic disempowerment of Black and brown persons, and the effects of which are revealed even through healthcare. As the health director and the Health and Human Services director here, it is my job to ensure certain safeguards are in place to protect our community. Many people understand our role as a department in inspecting restaurants, inspecting septic systems and housing facilities to make sure laws and protocols are in place to protect our community. But I am also looking at data regarding illnesses and diseases. The broad disparities of COVID-19 infections and mortality have been widely reported. The CDC reports that in New York, the death rate of the white Americans there is 45.2 per every 100,000 people. For Hispanics and Latinos, that rate is 74.3, almost 50% more. For Black and African Americans, it's 92.3 per 100, more than twice as much. The reasons for this disparities is not due to any physical or genetic difference between persons of color and their white counterparts, but because of systemic racism that directly impacts access to quality housing, work, education, and health insurance. In turn, the toxic stress from poverty and hypervigilance to not appear threatening leads to poor health outcomes such as high blood pressure, heart disease, and diabetes, all of which are complicating factors in COVID-19. We're seeing similar disparities here on Nantucket with similar representation in our COVID-19 demographics. The problem with systemic racism is that it feels invisible, but in so many ways, including health, it's not. Let's work together to equalize protections against COVID-19 for our Nantucketers and other health disparities as well. And we should work together to make that safe for all Nantucketers and all of us, all inclusive. So it is really important to mention at this point that the hospital, Nantucket Cottage Hospital, and us have collaborated to set up an active surveillance program for COVID-19 for all Nantucket residents. Please, if you go to the Nantucket website, the town of Nantucket website, and go onto the COVID link, you will find a link for testing of asymptomatic carriers. With that, with the funding through FinCom and with some funding through employers, and if you're an employer who is willing to pay for some of this testing for your employees, also go to that website and we can also work with you. And we can test and we can find all the cases so that we can get the treatment to those who need it. And with that, I'll turn it to the board for any of your questions and comments.
Comments from the rest of the board? That was well said. I sent myself a little donation to the hospital to the COVID fund the other day. So. Malcolm?
Yeah, just I think, Roberto, those were excellent words, and I think we all agree with everything he said. And we have to start looking at some of those issues, health issues on the island. When the dust clears from this, we can concentrate on that a little more.
I agree with Malcolm and Roberto and Steve.
I agree with everyone, and it was great, Roberto. What you said, and every word of it is the truth.
Thank you. I had a lot of help from my wife on that one too. So thank you, Aaron.
Okay. You want to get right to the emergency order discussions?
I think we've skipped public comment though.
Oh, yeah. Why don't we do that? And if you got any, yeah.
And if you have public comment, hit the raise your hand and I'll go ahead and recognize you here. And if not, we can move on. Okay, looks like we may not have some public comments, so we can move to the the emergency order discussion.
Okay.
So it's important. One of the things that we've been looking at, and we've been paying attention to all the reports every day. I update this root thing over here with all the numbers across the state, all the numbers we have, and we've gone to without a case again. The critical juncture for us was Memorial Day. That was our litmus test to see how we were going to be going. And Nantucketers, you passed. It was flying colors. It was amazing. People, you see people without masks and things like that, but there was more people wearing masks than those not wearing masks. And, the masks are our front line of defense. And one of the things we have seen is now we are over those 10 days after Memorial Day weekend, and we haven't seen any new cases. I did get phone calls from Mass General Hospital, Newton Wellesley Hospital, and one or two others calling me saying that there was somebody who tested positive who lives in Boston that was on Nantucket that weekend. And the fact that we haven't shown any cases here is a testament to the work that everyone is doing. It's an entire team. So with that, as a staff, we've been looking at this and we recommend that we can just go with the governor's orders at this point, both in the landscape and the construction, as well as the restaurants. I think we're at a good enough stage to rescind orders 1 through 10, except for number 4, which was a select board order, and which is the shellfish order. And I think I would request that the board, if you are comfortable with that, if you would like to discuss that. And Leslie, I know if you have any comments on that too, you're here as well. I would love to hear your comments and what you've seen from us as well.
Malcolm?
Yeah, I agree. I remember 2 weeks ago, I said we want to, with the construction and the numbers of people, keep it because I wanted to see how we did. And I think, as Roberto says, I think the island has done terrific. So I would be comfortable with going back to just the governor's orders. If I could make one comment about masks, In my survey around town, yes, there are people without masks, but what upsets me sometimes is I see people ordering food without masks and walking right up to get their food. And I did talk to one person. I wasn't received very well. But I think the restaurant owners and the food providers need to be reminded of this. No mask, no food.
That's fair. I know the governor's order requires the signs to be put up. So one of the things we'll look at is just to get those.
Yeah,
signs to work.
look at that, because it's the one area where I see a little sloppiness.
Okay. And you know, as retail reopens and things like that, we're going to be. That's what you may have heard a lot of conversations about the COVID educators. That's what the primary work. We're not going to get our seasonal inspector back this year, so that's the funding that we're using for the COVID educators, and their primary job would be to connect with the retail and food and even the public. And we're going to be getting some masks for them too, so that in case they see somebody who doesn't have a mask and they say, well, I don't have one, you do now. Something like that. So.
Colleen?
I got a question. The thing I see around town, especially the weekend, was young people. I would say like between 15 and 20 groups, 10, 15 people, no masks at all, just walking around town. And I don't know. I don't know why they don't mask on, or do they think they're, you know, Superman or what the deal is, but they just seem to I don't know, not really care that much about it.
And then it's a matter of personal responsibility with that, and there is education that we're trying to get done. And absolutely, we can speculate every day on why people aren't wearing masks. But one of the things that's also really important that we're explaining a lot when we get phone calls of we're seeing groups of 3 or 4 without masks. Sometimes those 3 or 4 people are actually family. And the order specifically says, you know, if you live with somebody, or if you're quarantining with somebody, for example, if you live in a dormitory and you all work together and you all live together and you quarantine together, they may not be wearing masks together because they know none of each other have it. Those are part of the little loopholes in the state governor's order. So we've been running into situations where we bring up the mask and there's just like, well, that's my brother. Okay. We're not going to fight somebody on that. If they say that's their brother, that's their brother. It's just where we are.
Okay.
Leslie?
I just want to point out, Roberto and I are both on an economic recovery task force, and one of the topics on that is communication and communicating to our visitors and our residents about a lot of things, including our local regulations and state regulations on wearing masks, because some of the surrounding states that people are coming from don't have the stringent rules that we have here. So that's something that we'll be working on.
And I see Bill Greeter has his hand. Thank you, Leslie. I really appreciate that. She's absolutely right. We're on this group, and the education is a big part. I see Bill Greeter has his hand up. I know Helene had her hand up. I'm going to try to find a way to get Bill Greeter on here, and then once Helene, go ahead.
Okay, Helene, go ahead.
This really, it goes, before we were talking about masks, going back to surveillance, and our meeting 2 weeks ago when Malcolm had said, you know, we will evaluate every 2 weeks. And I think we're at that point. I mean, we're 10 to 14 days out, and with no new cases, I would agree that we go with the state recommendation.
Okay. So for some reason, I'm not, there you go. I wasn't given the allowed to let Bill Greeter speak, so I had to have NCTV do it. So Bill, you should be live now.
Okay, thank you. I watched the select board meeting last night as they discussed the governor's, I guess Nantucket ended up calling it number 11. And to do with the restaurant seating, and it was it was hard to follow, given the conversation as they were sort of understanding it as they rolled it out. So if I understand it correctly, the seating requirements, distancing and all that is really a purview of your mandate. And could you go over what that really means, so that if somebody, how it's determined for inside seating, and then if they want to then go outside, how does that applicable to what the outside parameters are also?
So Kurt, we have Leslie and John here, so correct me if I'm wrong. As far as I know, with phase 2, indoor seating is still not allowed. It is outdoor seating only. The primary portion of that is the 6-foot separation, and it's not 6-foot separation of just the tables. It's a 6-foot separation of the people. So you need to have that separate. You can't just have somebody sitting back to back. So it's a matter of the available space that they have, which will determine that level of occupancy. And I think it's going to spill over to the interior. I know there's also a method that Order 11 is going to help for delineating that outdoor space. Leslie, can you help me on that one? I know there's a specific procedure that we outlined.
So with the governor's order and with our emergency order number 11 that you all will be discussing, there is minimum separation requirements between the individuals at each table. There's a maximum number of people, I believe it's 6, that are allowed at each table. In phase 2, as Roberto said, it's only outdoor dining, and the number of seats that are added outdoors would eventually offset the number that they can have indoors in a future phase if they choose to maintain those. So the idea is, to move their allowed seats from point A to point B, not to add more seating capacity.
Thank you.
And the process to do that, we have a streamlined procedure that's going through the licensing agent, Amy Baxter. It's online, you can apply, and then the building commissioner and the people at Plus can access those applications. And then we can do our review in conjunction with the health agents, the fire chief, and someone else. I'm drawing a blank, but there's 4 people that have to review them. The licensing agent, she's the 4th person. So they'll get a thorough review before they can move ahead.
Okay, thank you.
So which actually brings us to the next point. So we still need to vote to rescind orders 1 through 3 and orders 5 through 10. And then we would do a full order of, discuss the order of 11.
So it was 1 through 3 and 5 through 10.
Yes. So that we can go and be fully in line with the governor's order.
So
I move we rescind 1 through, what was it?
1 through
5 through 10 and 1 to 3.
Can I get a second?
Second,
By roll call vote, James Cooper,
yes.
Helene Weld,
Yes,
Malcolm McNabb,
Yes,
and Steve Visco, chair, says yes. So Rita's not here, but that's 4 for the good.
Excellent, thank you.
Yep.
So as far as order number 11 goes, I believe you all received it in an email, and this is literally the only thing we had in the packet for today, which was the same order that was discussed last night. And now we can entertain questions right now if you have any questions based on a discussion from last night's select board meeting.
I have one maybe for you guys. I'm just not sure. Is there a rush for some of these facilities that you'll see like by Monday, or is it it seems like it's going to be quite a review process to get your potential site approved?
From our end, I know Leslie's probably seen a much bigger onslaught than us. From our end, we had a lot of the people permitted already, and some of the outdoor seating had already been approved from before. It's the extra seating that's going through Amy and Leslie right now that I think I'll let Leslie talk because it's.
So I talked with Amy earlier today, and she's already received, I think, around 15 applications. At Plus, we've talked to several people as well. I think some of the restaurants have been working in anticipation of this coming forward, so they're going to be a little more prepared to submit the seating plan and the other things that are required. I know some of them have already been working with the tent companies to put up a tent so they can have covered seating outside. So I think there will be a couple of tiers. Some people may be ready, on Monday to go to the select board. I know that they're talking about scheduling a meeting so they can process, applications that are ready. There's going to be another tier where people are creating spaces on their property that hadn't existed for dining before. And then the third tier, if there are any, will be people that are using a budding property for their outdoor dining. So I think people are going to be moving really quickly. It's been a long spring without being able to operate. And I've talked to several people. They're, trying to, get going as soon as they possibly can. So I know Amy is processing. She's meeting with restaurant people today and tomorrow to go over what they need to get ready. We're ready at Plus to work with them. And I know the select board from their meeting last night is very willing to schedule special meetings and other things next week to adjust their liquor licenses. So I think time is of the essence. These businesses need to get up and going.
Any questions? Helene?
Yeah, I was not able to see the select board meeting last night. Was there any decision made about street closure?
I can't recall.
They did talk about that rather generally, and I think that will come later. Again, I'm on the work group that's been discussing that. And as part of the application process, the licensing agent has asked people to include in their application any streets or public properties that they would like to use. And then we'll look at all those together and decide where to go from there.
Anybody else have any questions? Malcolm?
Yeah, there was a comment in at least in the governor's order or some order about not using sidewalk space. Am I correct?
That's the first time here. Oh,
John?
John.
If I may, good afternoon. I'm not sure I've ever met with the Board of Health, so this is a real pleasure for me. So the way the order is written, if the seating plan proposes the use of a sidewalk or actually anywhere within a public right-of-way, it will have to be approved by the select board.
Okay.
So the only two things that the select board will be dealing with is, licenses to use town property, including public ways, and also the change in their liquor license. So the one issue I just wanted to emphasize is where the legislature is considering a bill right now that pretty much mirrors the governor's order. The Senate version, however, required a public hearing for change of premises under the liquor statutes. The House version passed yesterday stripped that out. So we're just waiting for the final version of the law to be enacted. But we have placed provisions in this order, even if a public hearing is required by law by the licensing board, then we specify how that will happen. But we're pretty confident that that the final version will not require that public hearing. So the law requires the select board to adopt the policy of how these approvals will be granted. So that's why the select board is on this order. But their role is actually quite limited. unless, as I said, someone's seeking a change in premises or a using sidewalks or public ways.
Anybody else? Did you have a question, Jim?
No, I'm pretty well. The only thing I was wondering about is number 18, number 17 about the first, second, and third offense. You know, if you break the rules, they go from 100 to 200 to 300. I mean, can't we make it to get to a point where you just pull their permit rather than keep finding these people if there's a problem?
Yes, I think that would be possible, Jim. This order is written to enforce what we refer to as non-criminal disposition. So it authorizes the health agent, a police officer, to write a ticket. The ticket has a sliding an increase in the amount of the ticket for subsequent offenses, but the maximum under the law is $300. There are a bunch of other enforcement options in here to seek injunctive relief, to go seek a criminal complaint at the district court, in which case the fine can be as high as $1,000. But certainly, if someone is repeatedly violating the order, then we could certainly consider coming back to you to request revocation of the permission. That would require a public hearing, and any other permits that are issued could also potentially be subject to revocation. But that's a long process. It requires a public hearing. So I'm envisioning that the fines and the penalties would probably be the way you would want to go. And if someone is repeatedly violating this order and it constitutes an imminent threat to public health, the most effective remedy very well might be going to seek injunctive relief at the Superior Court. That's going to get the most immediate cessation of the violation.
Thank you.
I think very rarely have we had to make things a criminal complaint with this board. The board's always been, we're not in the business of fining, we're in the business of compliance. So just the threatening of a ticket often, keeps the and straightens it out. So I don't think there's any issue.
And Steve, if you look at paragraph 19 on the last page, we actually say that in the order.
Right. Any other questions for John or Leslie? No. Can I get a motion for approval of this outside dining order?
I'll make a motion to accept it.
Second,
Okay, all in favor by roll call. Jim Cooper,
Yes.
Helene Weld,
Yes.
Malcolm McNabb,
yes.
and Chair Steve Visco says yes. So good to go.
Thank you.
You see any other public comments up there?
No, nothing yet.
So,
Steve, I'll
John?
take care of finalizing this order and getting it down to Libby,
okay.
and she can get it over to you as well. So we'll get that done right away.
Okay, thanks.
I think he wants it to have an effective date of June 8th, if that's okay with the Board of Health. That is potentially the date when, the phase 2 outdoor dining effect.
Yes.
Steve,
Yeah, go ahead, Jim.
could we add to that motion that the chair can sign for the board?
What have you done in the past, Roberto?
We've done that before. On some things, the chair can sign. On other things, we've had everyone sign. I think this one would be good for just the chair to continue social distancing. Otherwise, we would have to schedule each and every person to come in and sign.
All right, so we'll have a authorize. If you should take a vote to that effect. I would
I'm-
suggest a motion to authorize the chair to execute the order on behalf of the.
I move that we authorize the chair to sign for the entire board on this
Second.
order.
Okay, all in favor by roll call? Jim Cooper,
Yes,
Wayne Weld,
Yes.
Malcolm McNabb,
Yes,
and I guess Steve Visco, yes. So I'll find that in the Dropbox at 3 Chestnut and sit on the steps and sign it.
Sounds good.
Thanks, Leslie. Board member updates and concerns.
Yep. I just wanted to go back. I think we skipped just the metrics discussion.
Okay.
I just wanted
Okay.
to give a heads up that I'm still working on it. This week was just a little bit hectic. Things got a little ahead of us. So I'll get those metrics to everyone as soon as I can. Basically what it is we're looking at an average of the last 3 days if we start seeing cases, and then we'll take action on that. I think, John,
Can I sign off?
yes. Thank you,
Okay.
John.
Thanks, John.
For having you here.
Thank you. Take
you.
care, everyone.
We'll get that from you the next time.
Yes, I'll work on that this week. Sorry, I'm just so hot. I'll work on that this week, and I'll get that to you as soon as I can. Hopefully Monday morning.
Malcolm?
how about the status of the antibody testing?
So as far as the PCR and the serology testing, we're working on that. I know the PCR was probably the easiest one because we did it as a vote of the FinCom to get all the money available. The antibody testing, I think right now is an IRB review. I'll connect with the hospital to confirm that, but they should expect a confirmation soon. For those watching at home, IRB is the Institutional Review Board. They make sure that we're applying to all ethical standards for human subjects research.
It's a study that should be signed off quickly. There's no risk involved to anybody.
Everything's de-identified, and if there's no risk, I think it's done through discarded blood samples anyway.
Yeah.
So it's even easier. So I think it's going in through expedited review. It's just a matter of getting it done.
Lee?
Yeah, I had a question this morning. A resident wrote asking me about the reporting of the positive cases of COVID, and there seems to be some discussion on island of whether or not we're only reporting island residents versus non-residents, and if a non-resident tests positive, that gets reported at his or her point of residency. Do you know anything about that, Roberto?
So the way Maven works in the state is that if a person was only here visiting, let's say they were here for 2 or 3 days, like the 4, I believe, who called me from Newton Wellesley and Mass General Hospital to report that they were here, that case does get reported in that person's home at their place of residence. But we do get informed of every single case, and if they have an on-island address, we get the case, and the contact tracing does still happen. It's just a different team doing the contact tracing at that point.
Okay, thank you.
I think Bill has a question.
Go ahead, Bill.
Thank you. I just wanted to thank Roberto for bringing to the select board meeting the information that hadn't been put out there very widespread, and that's the fact that the wastewater treatment plant is doing testing to detect shedding, and so that the town has instituted a process for an early warning system as an advance notice of potential spiking of the disease. So I was glad to hear that that was ongoing, and it certainly is something that that folks needed to hear, that there is a possibility of finding out about this before all of a sudden you get 20 cars lined up at the hospital.
Correct. Yes. Yeah. So to give you a heads up, I mentioned at the select board, but I think Helene, you said you weren't here. You weren't able to watch it. The sewer department is doing the sewage testing, and they're checking for anyone who's actively shedding viruses in the virus in the sewage. And we are still showing up as non-detect, and the sewer department is checking it every 2 weeks on an ongoing basis. And the most recent report still came back non-detect. So we're really happy about that. And that is really good news. And as Bill just mentioned, thank you, Bill, that it is a way of doing an early detect, because you're actually shedding the virus before you're even showing symptoms of the virus. So it's actually it's really good at showing it's as an early warning system.
Yeah, I think in some of the studies, the one from Yale and that everybody looked at, it's pretty accurate.
It's very accurate. Yes.
Yeah, that's a good tool. Good tool to have.
Yep.
Any other questions or comments? No, everybody's good now.
Just we still have our monthly meeting on June 18th. Don't forget that. That one was moved to 1 o'clock. It's not at 4, so it is at 1 p.m. If that is still okay with anyone. And I don't know if we will have our new member at that point, because the election is June 16th, 2 days before that. So it may just be us 4 or us 5.
Okay. So, a motion to adjourn.
So moved.
Second,
Okay, by roll call vote, Jim Cooper,
yes.
Helene Weld,
Yes.
Malcolm Manab,
Yes.
Steve Visco says yes. And Roberto, thank you.
Our shortest meeting yet.
Thank you.
Yeah.
Thank you.
Well
All right,
done.
They all should be like this.